I'm Jane Hopkins. I'm the president of SEIU Healthcare 1199 Northwest.
My name's Faye Gunther, and I'm the president of UFCW 3000.
I'm David Keepnews, and I'm the executive director of the Washington State Nurses Association.
We would not be here today without the healthcare workers in all three of our unions, WSNA, UFCW, and SEIU, all across this great state of Washington, who showed up, spoke up, and led this fight. This has been a long fight, and we are not done yet. In this landmark safer staffing legislation, we made lawmakers pay attention, and we made the Hospital Association come to the table. And we won a law that will expand staffing committees, fix loopholes in existing law, and very importantly, open the opportunity for the Department of Health and Labor and Industries to require staffing ratios through corrective action plans for non-compliant hospitals. This is a huge, huge deal, and it took all of us and all of our power to make this happen.
The other thing that I'm really excited about, for years we have been talking about charters. It is important that there is transparency, there is accountability about what staffing committees are doing. And so what this law is going to do is going to make sure that every staffing committee has a charter. How exciting is that? That the voices of workers are going to be in this committee to make sure that we are doing what we need to do to make sure that patients get what they need, and that healthcare workers can have a break. That healthcare workers can give the care that they need, and they can go home every day knowing that they gave the care that they needed to do.
What this law is about, above and beyond all, is about accountability. It's about holding hospitals accountable for safe staffing, for following through on what their staffing committees decide, and for complying with their own staffing plans. They won't be able to ignore their staffing committees. Hospital CEOs won't be able to just veto what those staffing plans are. It also strengthens and extends hospitals' obligation to provide much needed meal and rest breaks.
Our members really needed this. We cannot afford to go on, have another pandemic and not be prepared to make sure that employers are staffing according to what we need to do.
Our members have faced down a global pandemic, a terrifying staffing shortage, a lot of trauma in the last few years. If you are still here, thank you. If you are still here, thank you on behalf of all of the UFCW, SEIU, WSNA members. Thank you on behalf of patients and colleagues. And maybe because of your fight, some of your previous coworkers will come back and new healthcare workers will stay.
We will be working to educate our members, to educate you on what the bill means, how it's going to be implemented, and how to use the tools that the new law provides. We're going to continue to advocate on behalf of our members, our patients, and our communities. We're going to move ahead on multiple fronts, in every hospital, in the media, in social media, at the bargaining table, and in Olympia, to keep moving forward toward our goal of safe staffing. This isn't a time to relax, but it is a time to celebrate all that you have accomplished. You should all be proud. You've taken your messages, your stories, your examples, you've got through to the legislators and the public that safe staffing saves lives.